Does it say it's recording on your end? All right, there we go. All right.
Yep.
So, we're talking today to Kim Balio Quill, who I know from University of Dayton. We were both in health communication together there. And so I had her on just to kind of talk a little bit about what she does as a health communication practitioner, and hopefully to talk a little bit about some of the how her work incorporates technology in the healthcare field today. So, Kim, I'll let you kind of talk about specifically what you do now and what your job title is at Dayton Children's.
Cool. Okay. So I am the marketing communications manager at Dayton Children's Hospital, and I've been here for almost 3 years now. And my role is primarily patient family communication and education. So I do a lot of work with our clinical team to help prepare materials for families before they go home to help them better care for their child. That ranges from everything from a cold to spine surgery to everything in between. So a lot of variation, and I've learned a ton about healthcare that I never thought I would know, but it's been a really, really great role. The other kind of part of my job is to do service line marketing. So that's working with our community physicians to help drive more business and to our endocrinology service line. And then with endocrinology in particular, so that's things like growth hormone issues, thyroid issues, and then diabetes. The big part of that is patient education as well. So that's kind of a good overlap of my two different roles here.
Absolutely, yeah. So can you talk a little bit about how in that second role where you're marketing, how that also incorporates the marketing or the patient education as well?
Yeah, so a lot of our families are referred to endocrinology without knowing what that means. And frankly, I didn't know what it means until I started doing work specifically for that team. So it's a lot of just, where are you referring my child? Who's my child going to see? What kind of a clinic is this? What kinds of things do you help with? And then basically, how can you help me? So particularly with diabetes, the long-term management with that condition is so education focused. So families really need to know how to measure blood sugar levels and give insulin accordingly, how to help with a healthy diet that helps balance carbs well. There's a lot in taking care of a child with diabetes, or there's a lot in taking care of yourself with diabetes if you're older. So a huge portion of our efforts is to help show that we have great support and resources for you as a parent, and then for your child to help care for yourself.
For sure, yeah. So sorry, this is like such a wide range of, like you mentioned, from all the way from a cold all the way to more of these chronic issues that these patients are going to be living with their whole lives. I mean, like, so are these videos things you make yourself, or are they kind of made by another organization? And how do you ensure that they're kind of distributed to patients? How do they see it? And does it help you kind of lead in a discussion with them, or how do you kind of integrate them into your practice?
Yeah, so we have a combination of homegrown materials and licensed content. So there's an organization called Kids Health, and that's out of Nemours Children's Hospital, and we license Delaware and Florida. They have 2 locations.
Oh.
So it's a group of physicians and nurses and medical writers who've created the hundreds, if not thousands, of pieces of education for hospitals to license. And then it's actually integrated into Epic, our electronic medical record. And then we also have it on our website for patients to access as well. And then we can use that as a starting point for our own materials as well as we need to. For diabetes in particular, and for a lot of the more chronic conditions or more complicated conditions, we end up creating ours from scratch. So that's just working with our clinical team, physicians, nurses, therapists of all kinds, depending on what kind of education it is, and really partnering to make sure that the education is clear and concise for our families. So I do have a background in health literacy and plain language standards, so I can help kind of take all this super clinical information and distill it down into something that a patient family could understand. In this way, it really helps that I have no clinical knowledge, because I'm at a different level than our clinical staff are.
And you probably feel like you're less in like the weeds, right? I mean, you feel like you can look at it from a wider point of view as opposed to getting stuck in all the details. And so.
Right. And if I don't understand it, our patient families definitely are going to, because I am still integrated in the healthcare world, just not as much as the clinical staff is. And then as far as getting that information out to patient families, so like I said, the licensed kids health content is on our website. But for our materials, we have an internal website where our clinical staff can go and order printed materials to give to the families. But we also just built, particularly for our diabetes patients, this diabetes resource center on our website. So that basically took the information from this 45-page manual and put it in these little kind of chunked sections, and then it links to the PDF if people want more information. But it's just to help give them, I hate paper, and I feel like that's becoming more and more common, that our parents don't want to leave with paper. They just want to know where to go to look for something online. So this resource center is a good step in the right direction. We have a lot more work to do to make our education more digitally friendly and make sure that families can access it on the go, because a big binder isn't always useful to carry with you all the time.
Absolutely.
And kids too, once you have teenagers who are transitioning to strict care for themselves, there's no way they're carrying around a binder with them.
No,
so
absolutely not.
Move in that direction.
So are the things online more kind of text heavy, or are they still, because I would imagine the videos would be more animation based, or like, obviously maybe having some sort of narration or something, but having a lot more visual. Do you think the stuff online more kind of text based, filled with information, or are there visuals in there as well?
Yeah. So the portion of our website that I kind of rewrote is very text based, text heavy. But that's just kind of the first draft of it. But then the PDF that we have does have a lot more graphics to it. That's something that we're working on too, is working on more animated videos, and even for some things we're trying to do like actual humans doing the work videos. But it's just time and resources. That's always the challenge.
Yeah. What do you mean by humans doing the work? Like, as in humans actually walking through the procedures themselves?
Right. Yeah. So we have a crutch training video, for instance. So it's a physical therapist who's actually showing you how to use crutches. That makes a lot of sense. For something like we just did an animated video for our neuropsychology department to tell patients what a neuropsychology visit looks like. That one was animated because it's just kind of saying, here's kind of what to expect. So we could use more graphic-y things, and it didn't have to be the specific tool that you would use.
Interesting. So do you you mentioned that you have integrated it into the electronic medical records. Is that something where when people go into their kind of portal and they see their lab results or whatever, that those links are just provided kind of alongside a certain kind of information area for the patients?
Yeah, good question. So it depends. So the kids' health information links directly into the after visit summary. So that's the printed information that a family gets before they leave. It also is a PDF in my chart, which is the portal. So you can access it there as well. The videos. So we have this platform called Get Well Network, which is an entertainment and education system that's actually on our inpatient TVs. And if you're assigned education, these health education videos through those TVs, you can get into my chart, and then through this Get Well Go app, you can access all the videos that you were assigned inpatient through the app. You can also access the whole kids' health library, but specifically the education that was assigned to you as well. We have integrated the videos that we've created from scratch into that video library as well. But as far as like printed education, those are not, if it's something that we created, those are not integrated into the after visit summary. That's another thing we're looking at, trying to streamline so that you don't get some information in your after visit summary and then a bunch more information in a printed piece. The more we can do to make it easier for families to keep track of everything, the better.
Good. Then you mentioned, especially for the things that the materials that you make yourself, you're dealing with, obviously young kids in some cases, and you're dealing with parents, and you mentioned plain language standards as well. So who is your audience for these videos, or for everything, I guess, overall? Is it primarily the patient, or is it the family, or both? Do you have stuff for both parties, or just kind of for the families in general?
Yeah, I would say most of our information is specific to the or addressed to the parents. So
Okay.
we'll say things like your child, you and your child, things like that. But there are certain materials or pieces of education that are aimed for kids who are starting to own their care. So an example of that would be, I just worked on something very recently. Oh, we're working on a ACL surgery binder. So in most cases, that's high school athletes or at least middle school athletes. So they're old enough to start kind of understanding what's going to happen and how to take care of themselves. So that piece is completely addressed to your child, or to you. I'm sorry, to you, me being the patient.
The patient.
We try to, in big documents like that, we clarify, like this document will be using you refers to the patient. We understand that maybe not all patients are able to understand this information, but instead of jumping back and forth or saying you or your child, that gets super clunky. So we try to clarify that right in the beginning. But I would say for the most part, it's the vast majority of our materials are directed to the parent.
Interesting. Good. Okay. And then you mentioned before entertainment education. And so would that be primarily anything that has kind of like an overall storyline where these kind of health messages are kind of embedded in this program, I guess? Or what did you mean by that?
Sorry, I missed.
The entertainment education?
Say it one more time.
Entertainment education?
Oh, yes.
Yeah. Mm-hmm.
Yeah. So that is, Get Well is it's a third party company that we have partnered with. So the entertainment piece of it is like movies and TV. You can access TV, games, you can get online, all that stuff through your TV in the room. We also have it in our emergency departments, and I think that's it. So really, what it's primarily used for is kids to watch movies. I think Frozen was like the #1 across all of their clients for like the last 5 years. But so the beautiful thing is it helps provide distraction, which is great for kids who are in the hospital setting. Especially if they're having like a procedure done or something, the nurse can turn that on, or any of our staff can turn that on and help distract them. There's also like a relaxing music channel, so kids can, with like pictures of fish that swim across, things like that, or live video of fish that swim across, that kind of thing. But the major thing that we want it for is to help assign these education videos.
Yes.
So we also have order sets. So our clinical staff can go into Epic, and let's say it's a newly diagnosed asthmatic patient, they can click to add that bundle of videos or assign that bundle of videos to the patient, and then that pops up on their TV screen and says, you new education to watch. And then they go in and watch those. And the beautiful thing about this system is that education actually documents back into the electronic medical record so that the staff doesn't have to do that manually. Unfortunately, it's hard to get patients to move away from Frozen and watch videos on asthma, and trying to get parents in there when the alerts go off can be a little bit challenging as well. But it's been a great thing for our hospital and a really beneficial tool to our staff and our patient families too.
Interesting. So this, and you mentioned that this is in their hospital rooms and not something that they have at home as well?
They can access all the videos through all the kids' health videos, which are primarily the education videos on Get Well. So it's kind of a partnership between those two organizations as well. You can access all those through my chart, but like they can't watch the movies or play games or anything like that through the app. Just access the educational stuff.
Okay. All right. Last question I have about this this area, about your specific work in this area. But what like outcomes are you guys looking for as a hospital once with your position or with this increased kind of messaging presence? Like, was this ever something that was addressed as a need, like through maybe some pre-testing or something? And what kinds of things are you evaluating the success of this on?
Yeah, that's a great question.
Mm-hmm.
So I'm actually, this role was new with me. So when I got hired on, I was the first person at our hospital to do this kind of education. And really, my whole first year or year and a half probably was just getting all of this education branded correctly. So a big part of it is to help kind of reiterate the message that we are a sophisticated, knowledgeable, specialty hospital that is conveniently close to home, which is great. So that was a lot of my first year and a half. Since then, it's adjusted a lot to how can we actually move the needle either on patient experience or on patient education. So depending on what clinic we're working with, the outcome measured could be like for surgery, do patients feel like they can monitor their pain better at home? Do they feel like they're confident caring for their child at home? We did a G-tube education book, so kids with feeding tubes, and we had a little like 5-question survey. Basically said, was this helpful? Did you learn something from this? And do you feel like you're better prepared to care for your child? So I would say that's most of the job now is making sure that families are comfortable and confident in taking their child home. Ultimately, it'd be great if we could measure how this education affects readmissions or A1C levels for diabetes, that kind of thing. It's really hard to tie a print material with those kinds of outcomes. Sure. Measuring print is just, besides like quantity that goes out, it's really hard to measure.
Yeah.
So that's again where this digital, kind of moving more of this digitally will help, because we can then track clicks and things like that.
Totally.
And do more like real-time surveys. So you finish reading a certain thing and a survey pops up and says, hey, was this information helpful? It's a lot easier to click that than to fill out a card, give it back to your nurse.
Or think back to something you read like a week ago. And yeah.
Exactly. Yeah. Yep.
Yeah. And then do you notice a difference in terms of different, I guess, demographics of different patients and families that you see being more likely to access this information or have success in using it? Do you see kind of a divide there in some of your patient based on demographics and their ability to access this?
That's a good question. I don't know the answer to that. I'm not sure that we've ever really looked at that. We do have a very large Medicaid population. I think over half of our patients are on Medicaid. So the way that we primarily take that into account is with the plain language standards. Visual things, I think, should really be part of our goal and part of our strategy. And I think part of that is also just the age of parents now. So we're starting to get into more millennial moms, and that's a whole different ball game than who we've been educating before. Yes. So from the age demographic perspective, I think we're going to see our strategies changing a lot, and hopefully, I feel like even the technologies that are offered across the board really aren't. They're starting to scratch the surface on really communicating digitally and like sending reminders for certain things. It's just all kind of clunky right now. There's not a great streamlined process for that. So I'm hoping that technology companies will start to enhance that as well. And I think that can help with bridging the gap between different demographics as well.
So how long have you been in? Oh, sorry, go ahead.
Digital just gives a lot more customization opportunities than a print material does.
For sure. Absolutely. Yeah. So how many years have you mentioned you're the first person to be in this position. How many years have you been doing this?
Just about 3 years.
3 years?
Yeah, it'll be 3 years in May.
Wow. So what did you do between your master's in health communication and this job?
So I worked for a health insurance company. So kind of a similar communication. It was a primarily Medicaid insurance company as well. So similar audiences, but I did a whole different kind of communication for them. So I did a lot of like request for proposal writing. So you have to tell the state that you basically are ready to care for Medicaid patients. And to do that, you fill out this huge proposal saying how you're going to do that. So I came on helping with that, and then moved through doing member communication. That's what we called it. So anybody that had our insurance, we helped educate them on anything related to their care. And then I actually did our provider network communication as well. So any providers that took our insurance, I did a lot of communication for that too.
So still very much in the kind of the education realm,
yeah,
right?
Yeah, very much education and healthcare too.
Mm-hmm. So did you, how did you get into communication as an undergrad?
Oh, that's a good question. So I knew that I liked to write, and it came pretty naturally to me. So that seemed like a good fit in college. I always say that my aunt did PR and marketing for the Shed Aquarium in Chicago. So as a small child, I thought that she worked with dolphins and wrote stuff, and that seemed awesome. So I was like, great, this is what I'm going to do for my future. And then as I got older, writing just continued to be something that again came naturally to me. And then looking at undergrad, so I was a PR major in particular, and I like the idea of being able to persuade and change behavior, but in less of a marketing kind of way and more of a messaging, bigger communications package of messaging. So it was a really good fit.
Right. Rather than just selling something, right?
Exactly. I mean, yeah. I really wanted to do, I wanted to do the whole communications package. And I took a sales class in college and absolutely hated it. So that was not a good role. Yeah.
Good. And so then when did the kind of emphasis on health come in? Was it later in your undergrad, or was it when you started, teaching or doing your master's, or?
It was, I would say kind of accidentally after graduation. So I really liked my health communication class. But
did you take it as undergrad?
I took it grad. Yeah. I really liked it, but I didn't really think about it being a career path, which looking back on it, it is such a natural fit for me. And I liked the creative part of writing, but I was much better at kind of the technical, kind of simplified writing. That was a really good area where I did well. So then after college, how did this happen? So there was an opening for a contractor position at this health insurance company, and somebody that I'd interned with had sent it along and said, I'll pass your name along if you're interested. And I was like, health insurance? This sounds like no fun, but it's a job. So I'll take it. And it ended up being just awesome. I was there for 4 years and worked in probably 4 or 5 different roles while I was there because the company was growing so quickly. So there was a ton of opportunity for moving around and trying new things and really expanding my skill set. And I really liked it. And then when this position came open at Dayton Children's, it just kind of seemed like the perfect, first of all, a little more fun than health insurance.
Yeah.
Not that it's not important, but this is working at a children's hospital is just, it's such a cool environment. Sure. And then I knew the work I would be doing would be a really, really good fit for me.
Right.
So I came over again almost 3 years ago, and I can't imagine not being in healthcare now. It's just such a dynamic field too, and things are changing all the time. And I think it's really interesting, this shift to the millennial mom, I think will be, or dad, or caregiver, whoever it is.
Right.
I think it's going to be really interesting to see how hospitals and health insurance companies react to this new consumer that we haven't really had before.
Yeah. Well, is it because we're a lot more savvy with kind of the internet? We've had this for a huge chunk of our life, and we're more used to getting our information online than the older generations. Is that what's kind of interesting about that?
Yeah, I think so. I also think I think we can look up information really easily. So we're not reliant on people to tell us something anymore. Yep. So we want to make sure that as hospital systems, people who are actually qualified to tell you information, that we're showing up when you start to look for things, and that we're your source of education. I also think that we have, with all this digital culture and digital environment we're in, with companies like Amazon and Google and Nordstrom and all of these companies that just have these awesome online presences. Zappos is one I always think of too. That expectation is not limited to retail. So I expect that if I need to send you a message at 11 o'clock at night, that I can do that I don't have to wait for your normal business hours.
Sure.
So that's been a big thing that we as hospitals are going to have to react to, is being able to be at your beck and call, sort of, or at least be available if you have a quick question, day or night. And then from the education perspective too, I don't want to flip through a huge binder, and I am happy to create them, and I certainly think it's valuable, but I think there's a lot more we could be doing to help meet people. I mean, like your phone, you could just flip through some kind of images on your phone that would show you how to, I'm not clinical, so how to measure your child's insulin,
right?
Whatever it is, rather than having to find your binder, flip to the right page and find that information. I just think we're all, we'd much rather have things convenient and digital than printed out in a hard copy book. And again, and you can search, I always say, you can search anything online. You cannot search print. So it's so hard to remember. I think I saw this thing in this page somewhere in my house. I'm never going to find it again. Yeah. Versus if I can just go to a website and search for what I'm looking for, it'll find the keyword in 3 seconds.
Sure. Yeah. And one of the things we talk about in class a lot is that, more information, more materials are not always the answer. It's how can we deliver the same, thing more simplified or more creatively.
Yep.
And
more customized too.
Absolutely.
I think that's another big thing is you might have, we're working on a binder right now for kids who have IBD, so Crohn's and colitis. And there are some parents out there who have it themselves, so their knowledge is really, really high, and they may not need all that background information. So can we get them with a digital format? We can help streamline that a lot more quickly than in a printed piece.
Absolutely.
And I think again, we're with all of the digital things, all the digital companies that are out there that are creating these really customized experiences. I think people expect that for healthcare and all areas of our life.
Absolutely, yeah. And the more the research shows, I mean, in this field especially, like the more tailored certain things are, health messages are, and the more interactive they are, the more effective a lot of times they are. And so that's really interesting. Okay, so last question I have is, so for someone who's, maybe thinking about going into a health field, in dealing with kind of either education or messaging in some capacity, whether it's, with working with providers or working with patients and families like you do, or doing some sort of just broader kind of insurance education or something, like what advice do you have for somebody who is kind of looking to break into a job like this in the health field?
Yeah, I think being open to change and adaptable is probably the number one thing. Again, it's ever changing, whether you're in the hospital world, the health insurance world, the referring.
Hello. Sorry, you just got you back.
Sorry.
Yep.
Okay.
So you said it's ever changing, whatever field you're in.
Yeah. So just be adaptable and ready and open to learning new things. I think this will never be a field where what you did 5 years ago will be the same as what you're doing in 5 years moving forward. It's very, very dynamic. I think you have to have an interest in learning new things clinically too. So I think you have to be ready to learn health information and education that you never thought you would know, or even without the clinical background. I think you have to be really excited and interested in working with different types of people. So from our doctors to nurses to physical therapists, everybody's very different. And the level of, there's a lot of differing perspectives in how to best communicate. So I think being comfortable, kind of working with people that might think differently than you do, but bring a very valid perspective is something that's really important too. And and then just really liking writing. I think that's going to be something that, regardless of how healthcare evolves or how healthcare communication evolves, you'll always have to be a good writer. So be comfortable in that, and know that that's something that you can always improve at as well. I don't think there's anybody who says, all right, I've reached the peak of my writing, I will never be better than this.
Sure.
There's always opportunity to learn more. And the other thing that's been really cool about children's hospitals is there's a lot of collaboration amongst different children's hospitals as well. So being open to ask questions of your colleagues in the field and see how they're doing things, and if there's a way that we could do kind of model their successful program at our own hospital. I think that's great. And then being willing to share what you're doing too, that's working well with patient families. It was not that way when I worked at the health insurance company. It was not as collaborative. And I don't know that it's that way even with adult hospitals, but I've been really impressed with how often and comfortable our team and other teams around the country are in sharing ways to help improve the patient experience, which at the bottom line, that's what everyone wants to do. We want to make sick kids better, right, or help kids from getting sick at all. So the more we can collaborate on that, the better the outcome.
Okay. All right. Well, thanks, Kim. This was great.
Yeah, thanks.
Talk later.